Oh, I am so excited to have one of the co founders from Change the Air Foundation on the podcast today. Thank you, Brandon, for joining. I'm super excited to interview you.
Thanks so much for having me, Dr. Stephanie. Really excited to be here and chat with you about the foundation, all the work we've got going on.
Yes. Oh, I can't wait to dive into the nitty gritty of it. But first, my favorite question I like to ask every guest is just what got you started? Like, what is your story that got you started in ultimately being a co founder of Change the Air Foundation and doing all the amazing mold policy reform and advocacy work that you do?
Yeah, so much like many other people in this space, I wasn't pulled into the mold realm and water damage realm by my own volition. It was because of a place that I had moved into, unbeknownst to me, which was incredibly water damaged and a sick building. A number of years ago, I was living in Cleveland, Ohio. I was a former air traffic control specialist with the FAA. And I had moved into a flipped house in a chic neighborhood. And after about 10 or 11 months of living there, I started to have really severe health symptoms. It kind of just came out of nowhere, really, for me. Um, I was experiencing neurological troubles. I was having constant headaches and dizziness and head pressure type feelings, fatigue, brain fog, word finding difficulties, insomnia, gastrointestinal issues. Now, this was highly unusual for me because as a former controller, I had to have a Class Airman 2 medical clearance to be able to do that position. And so when I was going to all my physicians at the Cleveland Clinic and University Hospital System and everything else, they were confounded at what could be causing so many multi-system symptoms in my body when all of the testing, the lab work, the low-hanging fruit that they were used to, giving their patients to try to suss out what was going on, were coming back normal. After a year of living in that building, and I was really in a bad state, a friend of mine told me that I should look into a small group at the Cleveland Clinic, even though I had been to a number of different specialties already, and I was pretty much at the end of the road. And he said, why don't you try functional medicine group here? There's about 4 or 5 physicians. They look at health and medicine a little bit differently. And I said, okay, sure. So I got an appointment off of a cancellation. And the physician there that saw me met with me for an hour, which was really refreshing because most times it was about a 10 or 15-minute appointment, and then they try to give you a prescription and then send you on your way, or maybe a referral. And we met for an hour, and I remember she was looking at all my symptoms, and she said, within a couple of questions, she said, "Tell me about the place that you've been living in." And I said, "Yeah, what do you want to know about it?" It's kind of in a chic neighborhood, exposed brick, hardwood floor. It's like a beautiful place aesthetically. She said, no, no, no. She said, any musty odors, any leaks, any water intrusion, anything like that. And I said, yeah, down in the basement, like all the time, because there was foundation issues, and there was a washer unit with a drain that was backed up. So every time one person would do wash in the building, there was 3 other people that lived there. It'd be water all over the place. And I said, yeah, down in the basement. And I'll never forget it. She stopped typing her notes. She took her glasses off, put them down to the end of her nose, and she looked at me and she said, "So tell me why this isn't a good story for mold." And I was shocked by that statement, that response. And I'm thinking, what are you talking about? The stuff that grows on your bread? And she's like, yeah, yes, but no. She said, I'm highly suspicious, given all of your symptoms, that you're living in a water damaged building and you're suffering from mold related illness and mold exposure. And that's exactly what it was. After we had the place tested by an IEP, it was just rife with mold. Aspergillus, penicillium, even some Stachybotrys and Chitomium showed up on an air sampling, which is kind of uncommon because those are heavier mold spores. I asked her, okay, well, now that we have confirmation, what do I need to do? And she said, you need to leave there yesterday if you can. And thankfully, I was able to do that. I was very fortunate. I was on a month-to-month in a rental, and was very fortunate to have safe accommodations to be able to move into at the time. But what I did was I started to look into other people in the state. Of course, I was in Cleveland, Ohio at the time, and I was wondering, man, I've never really heard much about this causing this much health symptoms for people. I wonder if anybody else has suffered this way. And it didn't take long to just go onto Facebook and find support groups with tens of thousands of people that were devastated by this, and quickly to find out that my story was not unique, even though I thought it was. Then I went a step further and said, well, okay, if it's this prevalent with this many people, I wonder if there's any laws or good public health information out there, or any research dollars going to this. And alarmingly, I found out there wasn't much at all. And this brought me into the world of, sitting in that experience, having my life basically at the time destroyed, and saying, why isn't anybody doing anything about this? And I came to find out that there were a lot of valiant efforts from individuals just like yourself that's trying to spread the word and help people. But societally, I felt like there wasn't a lot of work happening. So I did what I could at the time. I swear I'm going to get to why the foundation came to be. I started to write my state representatives at the federal level and at the state level and their staff to say, somebody needs to know about this, because it's not just me that this has happened to. I was meeting a ton of other people in the state. One office got back to me in my outreach to have a meeting. And turns out their Representative Joe Miller, and turns out his staffer at the time, she had gotten sick from the same thing at off-campus housing at Ohio State University. It was very serendipitous that I was able to connect with them at the time. We had a meeting. My physician at the Cleveland Clinic came in on a day off to meet, because I knew, I said, I don't have a medical background. I'm just learning about this. This was back in 2020. And she agreed to come in and tell him, we're seeing a patient basically in our unit once a day, at least for this, which he was shocked by that. And so he asked me if I wanted to help out, get a bill up and running in the state of Ohio at the time. Change the Air Foundation was not even an idea. This was just me as a constituent trying in whatever way I could to make some positive impact, or to spread awareness somehow to somebody about what had happened to me and what was happening to so many other people across the country. And Representative Joe Miller signed on to be a champion of that. And he should be applauded for that, because he kind of went out in the wilderness on his own. And a lot of politicians won't always do that until they see other people doing so. So we got one bill up and running at the time for a mold information and awareness program through the State Department of Health in Ohio. The bill got 2 really good hearings, didn't move much further after that, but we can get more into that later. But it takes a little bit of time and a lot of work to get a bill passed in general. But that's what got me pulled into the policy and advocacy side of this question. About a year later, I moved down to Orlando, Florida, and I got connected with 2 of our other co-founders at the foundation, Michael Rubino, who you may have heard of before, and also our incredible executive director, Kendra Seymour. She and her family were affected by this, and of course, Mike works in the space of fixing bad buildings for people that are mold sensitized. And we all came together and wanted to co-found a nonprofit focusing on indoor air quality, but really honing in on the mold and water damage aspect of this, because we found there wasn't a lot of indoor air quality nonprofits that exist out there, and the ones that do aren't really talking about this. And to us, given the prevalence and scale, which we can talk later about, it's the elephant in the room, and we need to do something about it. So we launched Change the Air Foundation in June of 2022, and we do a few things there. We support research in this space to try to get a better sense and understanding of the health ramifications from these exposures. We also provide free education and resources for anybody in the community, doctors, people that are suffering, staffers, lawmakers, other organizations. We provide checklists and guides, and we have Your Indoor Air podcast, and we have mini class series, which I'll talk a little bit more about. We were finding, and you probably know this too, Stephanie, is that when you first get sick with this and you're trying to find reliable information, you're going to all these different websites and they're telling you all these different things, and you're not sure what to believe, what's true, which direction you should take, and you're sick, or maybe your kid's sick. So not even having that reliable source, that hub to be able to lean on in such a time of need, we felt was a huge missing piece in being able to empower people to move forward. So that's another component. And then lastly, um, we felt, how do we change this as best as we can, or to try from the top down? And of course, that's policy reform. And that's what I lead as Director of Public Policy at the Foundation. So I work with volunteers, passionate, courageous volunteers that have stepped forward with their stories or their family stories. And they say, we'd love to try to emulate getting a bill proposed like you did in Ohio and some other states where we're living. But we're not quite sure how to do that or how to go about that. And then for me, I put on my nerd glasses and I'm like, well, I love this stuff because I'm a history major and I always had an interest in government anyway. So I was uniquely positioned to be able to do this. I kind of help consult and, get them comfortable with the process and, help them up the mountain there. And so we've had some really great success. We've had 8 bill proposals so far in 6 states, and we've had our hand in a federal bill proposal as well. So we just got our first bill passed too, but we can get into that later. But anyway, kind of an understanding and overview of what we do. Change the Air Foundation. We're trying to help families breathe safe indoor air across the country and live in healthy homes. So that's how I got started. And it's been 4 years, and I've never been more passionate about it.
Oh, what a great story. Thank you so much for sharing. It's so inspirational. And I have heard you mention on other interviews as well that you have this background in history and you've always been interested in this side of things in regards to what's going on, lawmaking, things like that, bill proposals. So I just think I don't think things happen by chance. And I think it's amazing when something does happen, you have this background and it just turns into this beautiful thing where now you're helping other people, you're helping spread this information, right? Co-founding this wonderful nonprofit organization. And it's just really cool to see when you see these things kind of come together and utilizing your skill set to be able to help others and spread such good information.
Thank you for saying that. Yeah, I honestly feel privileged, really, and I mean that, to be able to do this work because I really do enjoy it. And there's a sense, too, of the people that we work with that this is helping them. This is trying to put a silver lining into a really incredibly awful, difficult experience, is to say, I'm not just a number. I'm not just another casualty. I'm going to try my best to try to use this for good and to make a long-term impact. And there's something really beautiful in that, I think. And so I feel privileged to be able to do this. And I'm really heartened and just fueled every day that I talk to another person that wants to step forward and do the same. I think it's cool. So thanks for saying.
Yeah, of course. And I love that. So, you mentioned something earlier talking about how when somebody is going through this, they're feeling very sick in their own home, very confusing. It's looking to all different types of resources on the internet, talking to different people. It can be so hard to pinpoint where to go, where to start. And I think one of the first variables in all of this is it's really hard to almost contemplate that your home could be like your safe space, your sanctuary could be what's making you sick. So let's kind of contextualize here. How prevalent is water damage like in residential buildings or commercial buildings, even like within the US?
Yeah, great question. And this alarms people a lot. Although if you're in the mold space and then you get used to like looking for it in buildings, you're not really so surprised by this stat. But those who aren't familiar, we actually just produced a national report, a policy brief, and we worked with a couple of consulting firms on that. That's done work for some government agencies. And we wanted to crunch some of those numbers to try to get a good sense and idea of the literature and some of the surveys that have been done to really get down to that stat, right? We found that at least 50% of homes in North America have the presence of dampness and mold or water damage. Some studies have it as high prevalence as 85%, at least have had a history of water damage. So visually, if you're looking down the street, wherever you're at, every other home, you can almost bet that there is some amount of mold and dampness or water damage within that home. It's enormous. And so when you're looking at this from 10,000 feet, and when I'm talking to legislators and I'm telling them, like, this isn't just some small problem that's only affecting a few people. This is all over. And we're not putting any resources to fixing this and to helping people. And we don't really have a good understanding yet of all the health associations and ramifications from living in these buildings, or what it's exacerbating, all these health conditions, or what it's a primary driver of. And we have to ask why. But before we could do that, well, also while we're doing that, we had to provide them some information and stats and data. And so with that policy brief, which, by the way, we just put on our website under the policy tab, you can go down to a policy brief and you can read it. We're able to provide some of that data that was out there. So anyway, to answer your question, about 50% of homes could be higher.
Oh my goodness. And one of the things that you guys advocate for is like what you had mentioned earlier was like creating this awareness, creating public awareness and informational support for people, for individuals, for people even higher up that could do changes and help you guys along with making these changes in the country to support people that may be suffering from mold-related illness. So what are some of the supports and things that you guys focus around to be creating this public awareness? What is it that you guys focus on together to be able to create that awareness for whether it's individuals or legislators or whatever it is?
Yeah, it's a great question. It's like, what's going to have the most ROI of spreading awareness? And to be honest with you, it's going to take a lot of different strategies. And so that's what we try to employ so far. And of course, we're only 2.5 years old, but we're trying. And by the way, so are you. And so are all these other amazing people that are out there on their podcasts and reaching out. I mean, this is going to take a village to change. A couple of things that we try to do is be active on social media and building our networks to get the word out. We always do PSAs and videos on a few of the stories that we've been able to cover. We covered a story on a girl named Aria who had alopecia and lost all of her hair, and we found the family found that when they fixed all the stachybotrys mold that was around her bedroom window, of course she had some lead-based paint there too. When they remediated that, her hair grew back after about 10 or 11 months. We try to get those stories out there in particular because we try to show like this is really affecting kids enormously and families, but also it's hard to visualize something that's invisible. So that's a great story of being able to tell, like how is this affecting somebody, because this is an invisible illness in many ways. So we're working on LinkedIn and we're working through Facebook and Instagram. Every time that I'm having a meeting, right, and I tell this to our volunteers with one of their legislators or a staffer or somebody, I said, even if that meeting doesn't result in that person wanting to champion a bill or to do something about it, you've just planted a seed. You've just educated. It was totally worth your 20 or 30 minutes of your time to talk because that person won't forget that. I guarantee it. And oftentimes what happens is I'll hear from them later on that maybe they had another constituent come, or maybe they themselves had a problem and they're not sure how to navigate, but now they know about the issue, they know about the foundation, or they remember, the volunteer who came forward. So it's taking many different avenues to try to get the word out. And again, with this national policy brief, we're going to hope to send this to all of the offices, 435 congressional offices on the Hill at the federal level. But every time that we're having meetings, we're going to be sending this to them and all the statistics. It's getting on podcasts, right? It's our newsletter. So by the way, I'd be remiss not to say, if you go to our foundation website, please sign up for our newsletter because we put out a great newsletter every week and it kind of keeps you up to date on the resources that we're providing and offering, but also updates from some of the work that we're doing at the foundation, policy, research, etc. So it's kind of a multi-pronged approach. And I think the answer is we just all of us, not just the foundation, I'm talking everybody in this community, coming together, swimming in the same direction and working together to get the word out.
Mm-hmm. And what I want to reiterate too is something you mentioned earlier was, going to your website, going to the website, changetheairfoundation.org, right? There is a lot of resources that I wish that I knew about when I was going through my mold illness journey, right? And that a lot of people really could utilize kind of like step by step approaches in terms of, okay, we found water damage. What are the next steps? Like, who do we want on our team of people to help us? Because it is so confusing, especially when you do hire a mold inspector and they do air sampling and they say, oh, there's no issue here, but you're sick. And so it can be so hard. Like, what's the right testing? What do we do when we do find an issue? And so I just wanted to point listeners in that direction, that the foundation, not only are you guys, collaborating, doing podcasts, Instagram, LinkedIn, all these different things, but you have step-by-step approaches to help people, just to point them in the right direction and get them to that necessary like point to where they can start to heal and get better, fix their home, leave if they have to, whatever it is. But that's really important. And I think that is something, any of us who've gone through this, we're just trying to be that support that we wish we had, right, when we were kind of going through.
Exactly. And thank you for pointing that out to the listeners. Kendra Seymour, our executive director, has just done an absolutely phenomenal job getting this education and these resources with the help of many other subject matter experts and people at the foundation pitching in. Because, as she says, she wants to save the heartache of, what they went through and the information that they wish they could have had at the beginning, just like you said, for anybody else. And so we're continuously building out those resources and education. But so far, if you go to the resources tab, again, changetheairfoundation.org. And if you're just starting out, even, we just had a new Start Here tab, which has basically everything you need from the beginning of your journey down to the last. And it links to, all of our different resources, free downloads, our podcasts, if they're relevant. What certifications to be looking for an IEP, or what certifications to be looking for a remediator, or can I clean my items, and how do I clean my items, right? It's an all-encompassing one-stop shop that we're continuing to build off of. So I don't want to promise we've got every single thing, but we've got a lot, and she's done a great job. And so anyway, if you go there, Start Here, mold and water damage, start to finish. That'll be a great guide. If you leave with nothing else, just remember that exists. And then also, if you go to the resources tab, down at the bottom, you'll see free downloads. And there's about 12 of them. They're PDFs. They've got everything. I mean, that you could think of: mold remediation, contracts, 3 key people during your remediation and inspection process, questions to ask an IEP or a remediator, right? Signs of water damage, checklists for if you're going to rent or if you're going to be in a home. Where should I be looking? Again, moisture basics, all of these questions that we wished that all of us had at the beginning. We're trying our best to have that hub available to people. And if you just go there and check it out, you'll be surprised what you can find. So anyway, please lean on that.
Yes, absolutely. And to kind of segue into my next question, is that something that the foundation's also advocating for is firmer disclosures on mold and water damage, and what this means for somebody who is a homeowner who is renting. And again, just to bring up my own story, my husband and I, we had both gotten sick, me more so, when we moved into a place that we were renting. Little do we know that in the garage that there was water damage that was occurring pretty much yearly. What was happening was there was some sort of water flow from a neighbor's yard or something or other that just, for some reason, like especially when it rained, it was like a hill. So it was bound to just kind of get into the walls, get into like the garage area. You wouldn't see the water in the garage, but you could feel the moisture kind of building in there over time, especially during rainy season. Here in California is usually during the winter time. And we just both started getting weird symptoms. I would be fatigued. I was kind of getting a lot of recurring Epstein-Barr virus symptoms. Just, I did not feel good at all. And finally I went down to the garage and I looked and I started to see something black growing on the wall. And I was like, I told my husband, I said, this is not right. And so we contacted the landlord, and what they told us were, oh yes, this happens every single year. We just get in there, we'll spray it, and then we just put up a new drywall, and then it's good to go. And I was saying, I'm not well. I am not well. My husband's not well. And we didn't know what to do at that point. We ended up just, luckily, our lease was ending in about 2 months. So we just up and left. But at this, even to this day, I still don't know what I could have done, like what my rights were as a renter in that situation. I know it's different as well, probably state to state. But yes, you guys advocate for this, for firmer disclosures. Like how would somebody, like how is this legislated in the US, and like what protection is there in place for homeowners, renters, etc., to be able to navigate moving forward when they're in that kind of a situation? Because technically it was kind of in a situation you were in as well, and
Yeah.
many people that I know.
Yeah. The thing is, I don't want to paint a gloomy picture, but there's not a lot that exists out there for mold, at
And that's
least.
good to know, though. That's
Yeah,
good to
it
know,
is good to
right?
know.
Mm-hmm.
Because it should make us all feel more impassioned to try to change this, right? So that we're not continuing to kick this issue down the road for our kids, and for future generations. We need to deal with this right now. Um, to your point, there's about 19. And by the way, in our policy brief, we kind of do an overview of laws or lack thereof in many cases that are in place for mold in the United States. For an example, there's only 19 states right now that have any type of a disclosure for mold. The problem with that is that varies. So just because it just be, and this is important, just because your state may have a disclosure, you may feel protected, but you need to actually look at what that disclosure is. The devil's in the details. I'll give you an example. In the state of Ohio, if you're going to buy a home, right, they have the realtor's disclosure form for all sorts of different things, lead, asbestos, all that. Mold was one little line, and all it said was buyer beware that every home contains mold. Period. Now, of course, that should be alarming in and of itself that they're actually claiming that every home, um, but that didn't tell you much. That tells me nothing about, has this been inspected? Has this been remediated? Has there been histories of water damage? When were they? Right? How long ago? Was it recent? Is this ongoing? All the questions, right, that you found out later would have been so helpful going into it. Then you have states like Rhode Island's, actually, for tiny as they are, but they actually have a pretty good disclosure form. They're asking those questions. By the way, it's putting out a statement from the Department of Health. Buyer beware. The mold exposure can cause X, Y, and Z symptoms. More than just asthma, too. Headaches and fatigue and all that, which is good. It's also asking, are you aware of mold? Has it been inspected? Has it been remediated? I mean, it's asking all of the questions that we would like to ask. It's not a foolproof coverage, because there's always going to be people out there that might just not be honest about it. I mean, let's be real. But it's a great starting point to try to give people some transparency and information before they're making one of what I would argue, one of the biggest financial investments of their life, if it's a home, but also of their time, right? Even if you're renting, you're investing 90% of your time every day in a place that could be making you sick. So people have a right to know what they're moving into. So that's one of the things that we advocate for. And of course, when you look at all the state laws, there's actually 10 states in the United States that have no laws whatsoever for mold. A few of them are in the South, that you would think that where might be a little more prevalent just because of the humidity and hurricanes and whatnot. So we have a lot of work to do, and there's not really one state that stands out. I wish there could be, because I get this question a lot too, especially when I'm in meetings with legislators. Well, is there a state that actually has a nice framework out there that we can emulate? And the answer is no. Let me explain that a little bit more. Some states, by some I mean only 7, require a licensure or a certification requirement for a mold remediator or inspector, which means 43 do not. So, which was in the case in Ohio, I could have woken up the next day when I found out what was making me so sick, and I could have started my own LLC as a mold inspector. Didn't have to have any certifications for that or remediator. I could be a remediation company if I wanted to. And I think that's a problem that we're running into in the community is people are knowing what the problem is finally, that it is water damage and mold, and then they're going to the first company that they can find because they're scared and they're tired and they want to get this fixed. They want to have a safe haven where they're living. And they find various levels of knowledge and experience, and some get spray and prayers, right? They go in and just spray, which doesn't deal with the issue. And of course, it costs them thousands of dollars, and they go move back in and they're still sick. Now they're having to go back again to find somebody who knows what they're doing. We think that's such a travesty, and really, who's left holding the bag is the consumer, is the person that's dealing with this. And so we're trying to change that. You have other states like California; they have a little bit more public health information about mold exposure. Other states like Ohio, they had like 3 bullet points about what it could be, and then linked to the CDC and EPA, which of course you and I know their information on this is wholly inadequate and completely behind the curve. And that's it. And so I wish I could say that there was a state, but for people listening, if you're curious at what your state has in place, if you go to our website, changetheairfoundation.org, and you go to the policy tab, the policy and advocacy tab, there is a state map in there. And if you click on an interactive state map, and if you click on your state, one of the links that you'll find is through the Environmental Law Institute, which we update yearly, and they update. And that will tell you which laws may or may not be on the books. And then you can do a little bit more digging for yourself to see what protections you have. But largely speaking, Stephanie, I hate to say it, there's not much, which is why we have a lot of work to do.
Yeah, lots of work. Yes, thank you for explaining that. And it was a question that I wanted to bring up, and I'm really glad that you touched on it, was because this is something I know you guys are also advocating for, is the certification requirements for these mold inspectors or remediators. Like, there is really nothing for them to go through any process, right? To then be able to wake up one day and say, okay, this is what I want to do with my life. I'm going to go ahead and be a mold inspector or mold remediator. And as we know, bad remediation might even be worse than no remediation at all.
Yes.
Right? And
Yes.
then that's also leaving the consumer spending tons and tons of money on it, right? And then still feeling very, very sick. And it's sad that this is happening, but very glad that you brought that up, because I think it's important to point people in that direction to, again, find resources like at changetheairfoundation.org for who do you want on your team if you are suspecting that water damage or previous water damage was the case in a place that you are currently living in, because you want to make sure that you have the right people on your team to be able to get you through this, a certified IEP, everything, right? And so one question I do have around this is, can you explain to the listeners, like, what is an IEP, or who is an IEP, and why it is important to have somebody like this on your team?
Yeah, it's a great question. An IEP is an indoor environmental professional. That's what that stands for. Different from a home inspector who's doing a home inspection before a purchase goes through. A lot of people sometimes, this, and I'm sure you've heard this too. I've even talked to friends and family who know more about this. And I said, well, did you have it inspected or tested or anything before you bought it? And they said, well, yeah, we had a home inspector go through. And I'm like, okay, yeah, that's not really what I'm referring to. So what is an IEP? An IEP is somebody who is experienced in looking for water damage and mold and has certain certifications, and sometimes they have multiple certifications, that knows exactly what they're looking for to try to be that trusted, reliable detective in your home when you're needing to lean on somebody to see if it's going to be safe or not for you, or to find problem areas and to be able to properly assess where those are so that they can write up a remediation plan and give it to your remediation company, whoever you end up hiring, to do the right work, and so that you know exactly where all the problem areas are. And they use all sorts of different tools to do that, right? Moisture meters, and sometimes they'll do wall cavity checks and air sampling and tape lift sampling and dust sampling and looking for the signs of water damage. that just the regular person just wouldn't have a lot of the education on. Of course, if you go to the website and start looking at some of the documents and the downloads we have, you'll start getting there. But that's somebody who you want to get into the home first, or if you're living there already and you're suspecting a problem, so that you're able to find a trusted voice um, to be able to help you. So yeah, an IEP is super important. And I want to say this too, going back to the certification requirements, because that is something that we do, advocate for. Mostly at the state level right now. We're working at states. Um, because somebody has a certification, we also want to say this. That means it's a minimum amount of training, right? It doesn't mean that entity is going to follow the standard of what they got. However, it's a great starting place. And just to be able to make somebody who wants to be a mold remediator in their state say, well, yeah, if you want to do business here, you're going to at least have to get a couple of these certifications. And some of these certification courses are 32 hours or 40 hours, or at least like a week long. Some of them, you need to have a capstone. You need to have gone out and done work before. So like, it's just requiring more training than just taking a 4-hour in-person class or an 8-hour person class or doing it online and having some random certification saying that now I'm a professional and I'm going to be able to be the detective in your home to keep you safe, right? So we just like to mention that too, that looking for those certain certifications or licensure is super important. But to become empowered and educated about what a good remediation looks like, or questions to be asking an IEP or a mediator, which we have on our website if you go to some of our guides and downloads and our podcast, so that you're prepared to be able to hire the right person for you and your family.
Oh, thank you for bringing that up. And with our remaining time, I would really love to dive into more of what you do as well. Like you mentioned early on in the podcast that there was a bill that just got passed, I think you said last year. So I'd love to hear about it and what you're up to regarding that and other things as well.
Yeah, no, so yeah, so this is really my wheelhouse. So actually, the bill that just got passed was Senate Bill 1087, and it was in Illinois, and it just got passed in August of this year, actually.
Oh my gosh, so recent.
So recent, yeah, hot off the press. It basically, the bill did a couple of things, and this was in Illinois, by the way. Um, it requires all mold remediators in the state to have certifications. Of course, we like the certifications through the IICRC, and NORMI is also named. It requires proof of financial liability, so they got to have insurance, right? They'd be signed on to a registry with the state after the state gets proof of all of that. To have an active certification, by the way, not just one they got 15 years ago. So they need to stay up with it, because when you have an active certification, that means you have to keep doing continuing education, etc. And also another huge component of that bill was to ask, or to mandate really, that the Department of Public Health in Illinois create and put forward a mold information and awareness campaign about the dangers of mold exposure and why it's important to remove it appropriately. So it's a twofold bill. And while it doesn't cover all the other aspects of this problem, the insurance issue or building codes, etc., it's a great starting place. One last bit on that, this heartened us, is that bill was bipartisan. So Republicans and Democrats came together on that bill, and not one person in the Illinois Assembly voted against it. Not one. It got passed unanimously. So what does that mean? Anybody that wants to volunteer or come forward, this is just common sense policy. This is policy that a lot of lawmakers and staffers, when we talk to them about this, or they're listening about these stories, heartbreaking stories from their constituents who are in their offices, a lot of them go, I thought that was already in place. They take, right, because it's so logical that they thought it was already in place, because it's in place for lead, lead-based paint, radon, asbestos. And so oftentimes they're really moved to want to do something about it. So it really takes people that want to volunteer to come forward, come to our website, reach out to us. volunteer with us, and let us work with you and some of these other allied organizations to be able to get you comfortable with what that looks like, about how do I reach out to my reps? Who are my representatives? I don't even know who they are. Can you help me with, a letter template of what I need to say? Can you help meet with us? That's what we do at the foundation, and that's how we get this thing started. So Illinois bill was a direct result of 3 volunteers who came forward in the state roughly around the same time. It was kind of serendipitous, and all got sick, or their families got sick, and we were able to get their representatives directly to be the chief sponsors of the bill, which is what ultimately, along with our advocacy and helping them push it along with some other orgs, get passed into law. And so, proof of concept. This really can work. Your voice and your experience really matters. It's just, stepping up and stepping out, and all of us kind of helping one another to get that done.
Oh, that's amazing. So this is not my wheelhouse. So I'm going to ask a couple questions here regarding how this works, getting it passed, especially because you said that everyone bipartisan had voted unanimously to get this passed. So I'm assuming that you have, or other individuals, volunteers have tried to have maybe similar bills passed, but why? What's the defining thing that, I'm sure there's multiple, but like what allowed that to get passed versus maybe if you've already been trying in another state? Is it regarding how many volunteers you have and how much they're speaking up and being advocates for this? Is it a matter of who they're speaking to, state representative wise, versus like if they're open to this, or if they're just completely shutting it down? Like what are kind of the variables here that get something moving in the right direction, I guess?
It's a great question. I've actually never been asked that question. It's a really good one.
Great.
A number of different variables in politics, okay, right? So I'll give you a few examples. In Ohio, the first bill I got proposed, my representative was a Democrat who was in the minority party in the assembly. So we were already starting off trying to get a bill passed. That's a steep climb in and of itself, which was made a little bit steeper just because he was in the minority party. The majority party, if people don't understand how this works, if you're the majority party, and in states it's either the Democrats or it's the Republicans, that varies state by state, they have control of the committees. They have control being president of the Senate or speaker of the House. They can control which bills get heard or which bills get passed, right? In the case in Ohio, because it was a Democratic-led bill, at the time, some of the Republicans there were a little bit hesitant to move the bill forward, which seems petty, and in a way it is, just to not give the other party a win. But that's why we're trying to focus on getting bipartisan support on these bills right off the bat. Another state, we had the disclosures component in one of the bills, which was not a component in the Illinois bill. The Realtors Association in the state lobbied against it behind closed doors, because it doesn't take a rocket scientist, but anyway, if somebody's trying to sell a house, and I'm not dogging realtors on all this, because certainly there's many that care deeply about this, but I don't believe they wanted the disclosures component to affect sales. So interestingly enough, if we took that component out of the bill and it just remained with the public information awareness program and certification requirements, they don't have a problem with that at all. So you really are, each state is going to look a little bit different, because every state has different laws on the books already. So like here in Florida, I'm in Florida, we wouldn't necessarily be asking for a certification or licensure program, because certifications and licensures is required here now. But we might be asking for firmer disclosure. We might be asking for more public health information, right? We might write more appropriations to this. Every state's going to look a little different. So it keeps my job interesting, because I'm not able to just say, sometimes we can have a template of a bill, which we think in Illinois is actually a pretty good template. It's a cornerstone for us to build off of. So once you got to remember this too. Once you get that one bill passed, most of the assembly is at least a little bit familiar with the problem. So now it's not just selling them on the issue. They've already passed that. So now if you want to build on that with other facets of this problem and things that we advocate for, I think they'll be a heck of a lot more open to it. So I'm not sure if I answered your question or not, but that's why in some states it didn't pass, and in other states it did. What made Illinois unique was that it was a bipartisan bill. So Republicans and Democrats were already coming together on it at the start. And I think they just realized that this just is just common sense consumer protection and just information for the public. It really wasn't going to affect anything else aside from just helping people. So.
No, you did answer my question, and ultimately the goal is just to get the ball rolling, right? It can be a domino effect after a certain point, right? Like we get one thing passed, we get more awareness out there, right? We just keep building and building, and like you have been mentioning throughout the podcast, is it takes a village. So we all do our part, and we all work together to try to get more awareness out there. And then in terms of what you're doing, right, getting at that level where we're trying to get things passed and influencing others to hopefully do the same, which leads me to my last and final question is, if somebody does want to get involved because they are so hyped I'm hyped after hearing all that you talked about on this conversation. Yes. So, what are kind of the steps then? I think you briefly touched on it earlier on, but, where should they go on the website and get into contact with you? I'm assuming, what are the steps somebody can take to kind of start to bring more awareness of this and maybe work on getting some things passed in their own state?
Yeah, great. And I'm so thrilled that you feel like passionate about doing something. I mean, honestly, you and I should really talk about doing some work together, even
I agree.
offline about this. And because, why? Because anybody can do this. Yes. Anybody can. You know, I started off having no experience. I just knew that I could go to my lawmaker in Ohio and write about it. Didn't know what was going to come of that. And so part of my mission here and what I get so much warmth out of is like, and I tell people this, and I always put this out in the universe, when we get this passed in your state or this issue and we make an impact, you can now take what you've learned about the process of advocating for an issue, right? Starting with an email or a phone call to the representative's office, meeting with them, getting them to move on a bill or getting to propose a bill, then working it through committee, right? And then getting votes on the floor, and then hopefully the governor signs it. You can now do that with anything, any issue, anytime for the rest of your life. So that's something that I really enjoy, is getting people more involved in our democratic process. So I felt like it was unreachable for a lot of folks. But getting back to your question, if you go to our website, our policy page, or the contact us, you can email us and let us know that you're interested in this advocacy and policy perspective, and we'll set a meeting up, and then we'll kind of just do a quick overview of the process, and then we'll go from there. You can email me. My email is brandon@changetheairfoundation.org. That's also a direct way to contact me, or message us on one of our social media accounts, and they'll find a way to get it to me. But we'll start with a meeting, and what our goal is to then get a meeting with your representative. That's goal. Then the next goal is to hopefully get a bill proposed. So we just keep moving those goalposts every time. So anybody can do this. I just want to make people understand that, like, your voice matters, your stories matter, and that's what's going to change this thing for good.
I like that you mentioned that anyone can do it, because from the outside looking in, someone sees that you're part of a not-for-profit organization, right? A nonprofit organization, and probably thinks it looks easier than it is. But you didn't even start out with this. You started out just when this occurred to you, just emailing, getting letters out to anyone and everyone that would listen, and one person had gotten back to you. And so I think that's the key point and the key takeaway here, is that anyone can do it. And I'm so glad that you keep bringing that up. So absolutely wonderful. This was so inspirational, and very excited for people to listen to this podcast, look at the resources on changetheairfoundation.org, and hopefully get into contact with you about making some changes in their state. So thank you so much, Brandon. I would love to just leave it with any final remarks or things that you wanted to mention for the viewers and listeners regarding, you've already mentioned kind of where to find you, but where they can find you and how they can get in touch, things like that.
Yeah, well, first of all, Stephanie, thank you and everybody at the Holistic Hub podcast community for having me on and just giving me a space to talk, all of us a space to have this conversation. I think this is what matters at the end of the day, like talking, having ideas, and then putting them into action, right?
Yeah.
Um, at the foundation, if you again, if you leave with nothing, just know that we've got all these incredible resources available. Go to changetheairfoundation.org, sign up for our newsletter. That's super easy, and you're going to just be given access to every week. You're going to have all these different resources and updates and whatnot. Also, would be remiss to say we are a nonprofit. Most of the nonprofit are all volunteers. And so, if anybody out there feels philanthropically inclined, or if you have charities that you like to consider, I just ask that you kind of throw our name in the hat there as well, or anybody that you know. It goes such a long way in enabling us and empowering us to keep doing this work for the community. And then also, just again, if you want to contact us, go to our contact us or info@changetheairfoundation.org. Of course, mine's Brandon at changetheairfoundation.org. Go to the website, go to social media, message us, and somebody will get back to you. But again, just wanted to leave this to thank you for everything that you do in helping your community, especially speaking about the health perspective of this and just spreading awareness, and also for giving us at the foundation a space to talk to your community about the work we're doing. Thank you, Stephanie.
Oh, thank you so much, Brandon.